Welcome to this special edition of Community Health Matters for senior viewers, especially for those who are receiving Medicare services. It's critical for you to watch today's program because whether you have Original Medicare, Medicare Advantage, or a Medicare D prescription drug plan, you have only one opportunity each year to make any changes you want. This opportunity is Medicare's Open Enrollment Period, also known as the Medicare Annual Election Period. To help us figure out some of these important health questions, we have Wayne Knight, who is the Senior Vice President of Medical Services at Tri-City Medical Center. He's responsible for developing and implementing the hospital's healthcare reform strategies, managing the hospital's accountable health organization, along with all health plan contracting efforts on behalf of the hospital. Wayne, thanks for joining us on this episode of Community Health Matters. With that kind of job title, I'm surprised you have even a minute to spare for us.
Well, it was a quick minute, but thank you very much for having me today.
Well, let's start with what are a person's Medicare choices that apply during this choice period?
Well, this is a time of year that a person that is eligible for Medicare can make the choice to either go with the traditional Medicare, which is the Part A and the Part B, for physician and hospital care, or they can choose a Medicare managed care plan, which would normally include the aspects of traditional Medicare, will also include the Part D insurance coverage or prescription drug coverage. So you have to kind of weigh the benefits. Do you want to have the choice of a Medicare plan that puts no limits on providers, but may require you to buy Part D coverage, or may require you to buy Medigap coverage? Or do you want to go with a Medicare Advantage plan, which generally wraps all these things up in one product? However, this is the time of year that you have to make that decision.
Well, a question that comes up frequently is there any crossover between what we're here to talk about today, namely Medicare, and Obamacare?
Actually, there's no crossover whatsoever. If you are eligible for Medicare, you are not eligible to participate in the insurance exchanges commonly known as Obamacare. As a matter of fact, it is illegal for a broker to sell you a product. They are designed to be mutually exclusive healthcare choices.
Very good. So when can you join Medicare or the Medicare Advantage plan? What are the specifics?
Well, there's 4 times in a person's, in the course of a year that you can join. First of all, there's the time when you turn 65. There's a 7-month window, the 3 months before you turn 65, the month you turn 65, and the 3 months afterwards, that you can choose a Medicare plan or Medicare Advantage plan. If you're past that period of time, then the open enrollment period, which is what we're about to enter into now, is October 15th through December 7th. At that point in time, you can opt out of traditional Medicare and go to a Medicare Advantage plan, or you can go from the Medicare Advantage plan back to traditional Medicare. There's also a disenrollment period, which starts in January 1st and goes through February 14th, where if you're not happy with your plan, you can disenroll and go back to traditional Medicare. There are also something that are called special election periods. For instance, if your employer is providing you Medicare retiree benefits and that changes, or you're forced to move out of the area and you find yourself in a new state or new area, you can make choices at that time. But for the greatest majority of people, the open enrollment period of October 15th to December 7th is the time when they sit down, take a look at the plan they've had, and make choices for what they want to do in the following year.
So just to reinforce this, you can't just comfortably decide that you're going to do this the year you turn 65, because if your birthday is early enough in the year, there's going to be a gap between the 3 months after that month and October 15th.
That's correct. That's correct.
Okay. So open enrollment is what we're here to talk about mostly, and what is open enrollment?
Open enrollment is the time when you are able to say, you know what, I like the insurance plan I've had, and I want to keep it, and in that case you need to do nothing. You can say, I do not like the plan I have because they have raised the benefits or raised the co-pays or raised premiums, and I want to switch to a different plan. It's the time you can do that. and it's a time you can say, I want to stay in the Medicare Advantage program, but I want to go from this plan to that plan. And there are many reasons why people would do that. Some plans charge monthly premiums. Some plans don't charge monthly premiums. Some plans charge higher co-pays or office visits. So it's a very important time to sit down, read your benefits, find out what's out there, and find out which plan is appropriate for you.
Do you have as much freedom the second time around, or third or fourth in open enrollment, as you do the first time?
Yes, you do. Each year at open enrollment, you're free to make all the choices that I just described.
Okay. So it's a chance to correct any errors or misconceptions you had the first time around.
Well, it's a chance to do that. Also, you may find that your physician has retired or no longer participates in that plan, or the specialist that you see, your cardiologist maybe, is no longer, if you chose HealthNet, for example, I'm just picking on HealthNet, and your provider's no longer with HealthNet, but they're with SCAN or they're with United or something like that, that's a reason you may want to change. You may have entered a period in time of your life where prescription medicines are much more expensive and much more part of your life, and so you may say, you know, this plan doesn't have Part D coverage. I need a plan that has Part D coverage. So we always encourage people in open enrollment to look at themselves, look at their circumstances, what's changed about them, what's changed about their network, and make choices based upon that kind of self-awareness.
Okay. So it might not be a mistake then. It could have been right for you then, but it's not right for you now.
That's correct.
Do any of those changes constitute a special enough event to have one of those special exemption periods? For example, a major change to your prescription situation, or a key physician leaves the network in the middle of the year?
Those would not qualify for the special election period. Special election period is when your your life circumstances change in such a way. For instance, you lost coverage, or you moved from, you know, Nevada to Wisconsin or something like that. So you have to make new choices because perhaps Blue Cross in Nevada, there is no similar product in Wisconsin, something like that.
So it would pay to project forward a little bit then, because you really only have a once-a-year shot in most cases.
That's correct. Now, in the course of a year, if you are with Plan A and your doctor should retire in the middle of the year, you obviously can choose a new doctor, but you have to stay with that plan. So it's often important to look at the network and see all the different physicians that are in there. People may change physicians throughout the year, but they can only change the plan and the benefits that go with the plan once during open enrollment.
Okay. Can you switch plans more than once during the open enrollment?
You can make changes beginning with the first date, which is October 15th, all the way through December 7th. However, the last plan you choose will be the one you end up with. So there is that window to change your mind as often as you want between October 15th and December 7th.
Can you think of a reason why there would be changes within the open enrollment period? Is that common?
It's very common. Plans each year look at the marketplace, they look at their expenditures, they decide we want to expand the marketplace, so therefore we're going to drop the premium, and they're going to try and buy the business that way. Other plans may say we lost a ton of money on prescription drug benefits to our patients last year, so we're going to cut back on that benefit. So it's always wise to look at that. Anybody that's currently on a Medicare Advantage plan should have received on October 1st a booklet from their plan saying changes we're making in 2016. In essence, that's what it looks like.
It sounds like it's almost a recommendation that if you make an early choice, to take another look just before December 7th?
It's always wise to keep your options open, and because you may learn about a new plan. You know, perhaps if you went to an open enrollment class or something like that, they don't talk about all the plans necessarily that are there. So I would make my decision and reevaluate it as I get closer to the December 7th cutoff.
You know, you're opening up the next question, which is what Tri-City Medical Center does in support of open enrollment, and I know those classes are part of it. Before we get to that, can you give us a rough idea of the number of plans that someone's faced with, number of choices?
I think there's between 8 and 10 plans out there that offer Medicare Advantage. It is an expanding marketplace, and whereas, say, 7 or 8 years ago, there were 2 plans, maybe 3. A lot of players have entered the field, so this will be an exclusive list, but off the top of my head, we have Blue Shield, we have Blue Cross, United Healthcare, HealthNet, Scan, Care First. These are the ones that come to my mind, but there are a myriad of offerings out there and a myriad of players.
Does the name of the provider define the plan? In other words, if you say Blue Cross, is there one plan or are there multiple plans that Blue Cross might offer in a given year?
In a given year, Blue Cross will only offer 1 plan per county. So they may have the Blue Cross plan that they offer to everybody in San Diego County. That could be different than the Blue Cross plan that they offer in San Francisco. They have to register with the federal government every plan they're going to offer, and they have to register the benefits, but it's by county. So you could actually elect to participate in San Diego County and not elect to participate in Imperial County.
So you need to be cautious in basing your decisions based on a relative who's exactly the same age with exactly the same problems in Merced or some other county?
Well, we always encourage people to look at their own circumstances, and so again, as I said earlier, your personal needs, your physician of choice and everything like that are stuff that are unique to you. In our business, one of the things that physicians will say is that you, as an individual, need to take charge of your own health care. And this is an example of how people can take charge of their own health care.
Are the county differences significant?
Generally not. There'll be possibly copay differences or maybe formulary differences. The health plans are very sophisticated. So they know what to offer and what's going to sell where.
Well, we've got about a minute before the break, so let's introduce the topic of what Tri-City Medical Center does to support this. Of course, this show is one example. What's the first thing you'd like to talk about in the minute or so we have left?
Well, Tri-City is very cognizant of the seniors that live in our district, Carlsbad, Oceanside, and Vista. And so we take open enrollment as a very serious opportunity to try and help out our constituents. The Tri-City Medical Center is going to be conducting 4 insurance or health insurance forums this year. 2 of them are going to be at the hospital. 2 of them are going to be at the Wellness Center in Carlsbad. And the dates and times are on the hospital's website. It's a time for people to show up. There'll be brokers, there'll be plan representatives. You can ask the questions, pick up the pamphlets, compare notes, have one-on-one discussions. We facilitate that because we think this kind of choice is very important to the members of our district.
Let's take our break, then we'll come back and talk about exactly what goes on at those meetings.
Thank you.
Thanks, Wayne, and thanks for staying with us. We'll be stepping away for a minute or two. Stay with us.
Flu season is here, so now is the time to consider getting a flu shot to help reduce your chances of catching this season's flu. According to the U.S. Department of Health and Human Services, the flu shot is the best protection against contracting the flu. The cost of a flu shot is often covered by your health plan. Check your benefits documents and with your health plan and schedule an appointment today by calling your physician or visiting your local pharmacy or convenience care clinic. Many employers also offer flu shot clinics in the workplace. For more information, visit flu.gov. This message is brought to you by United Healthcare and this station.
We are this close.
We're this close.
We are this close.
Of wanting to
making history.
This close to changing the world.
We're this close.
This close.
This close to making sure no child suffers a crippling disease.
Ever again.
this close.
We are this close to ending polio.
Ending polio.
All we need is you.
This close.
If we don't act now, we may lose this chance forever. Help Rotary make history at endpolionow.org.
Welcome back to our Medicare Open Enrollment Show. Wayne, when we left, we were talking about what Tri-City Medical Center does in support of open enrollment, and you started to talk about the information sessions that you folks host.
That's correct. This year we'll be hosting 4 separate information sessions. 2 of them will be at the hospital. The first one on October 31st, which will run from 8 till 11 in the morning. And there's a second one at the hospital on December 2nd, which will run from 2 to 5 in the afternoon. The hospital, for those who may not know, is on the corner of Thunder Drive and Vista Way. We're also offering 2 additional information sessions at the Tri-City Wellness Center, which is on El Camino Real, just south of Palomar Airport Road. The first one will be on October 16th. Will also run from 9 to 11. And the second one will be on November 9th, and it should run from 10 to 2.
People should expect to go to one of these, correct? They're virtually identical.
You only need to go to one, unless you have a friend you want to take to one, but they are going to be the same information at all 4 sessions. We just try and maximize patient convenience as to where they can go.
So what should people prepare for? Should they come with a list of written questions? Are there some documents they should be bringing?
They should come with a list of medications they're taking. They should come with a list of what their copay is, what their out-of-pocket currently is, the name of their provider, their primary care provider, any specialty care physicians that they want to make sure they can continue to see. It's again knowing what your health care is and what your health care needs are. Bring that information with you and be able to ask the appropriate questions.
Are these presentations, or do you get one-on-one time with representatives of the various plans?
They include both. There will be a formal presentation, but each of the plans will have their own area, and you can sit one-on-one with the plans and or the brokers and ask some of these individual questions in a comfortable setting.
We talked earlier about maybe a dozen choices or a dozen providers. Is that about the number of people who show up for this?
It depends on the day and the time, but you'll get the fair representation of the big plans.
And about how long would it take to get the kind of information you need?
Well, one-on-one time with a plan representative or a broker, you should be able to cover most of your concerns within 20 to 30 minutes.
Would you consider this to be pretty all-inclusive, or is this part of an overall decision process?
It is not designed to be all-inclusive. It is an information session and a way for people to begin the exploration. But a lot of it comes down to knowing what all the options are. Again, there's many websites devoted to this. You can always go on to Medicare.gov and go into open enrollment and look at that. So there's plenty of options. But this is one way for people to get exposure to their options and to be able to ask some questions in a one-on-one setting that be relative to their specific needs.
Okay, I'm sure there's some people who want to write this down. We will revisit those dates just before we close the show. What's an IPA?
Well, an IPA actually stands for Independent Physician Association. An IPA is integral to the Medicare managed care process. These are organized medical groups where various physicians have come together under one heading to accept the risk and offer the plans that they feel are appropriate and that works for them. And so you can choose an IPA when you choose your Medicare Advantage plan and choose any one of the physicians in that IPA. Again, these are generally based in one part of the county. Sometimes they're larger groups that cover most of the county. In Tri-City, we have 2 IPAs that work closely with the hospital. They're also organized medical groups, plans like Kaiser, employed physicians like UCSD. These are all integral to the process. Individual physicians, your man or woman that's hung a shingle and is a sole practitioner, generally don't participate in these plans because these plans involve the physicians taking risk, and so you need a size to be able to manage that risk.
Yeah, this is not the first show we've done, and this is not the first time I've asked this question. How again do they fit in? How are they integral? In effect, are you choosing an IPA instead of choosing an individual physician? or do you still go for an individual physician, just be aware that they're part of an IPA?
The latter part is correct. If you say, I want Dr. X generally will be with one group, one IPA or one organized medical group. And so if your route is, I want this primary care physician, you choose the group that they're with, and then you choose that physician.
Okay. Now, these people are not, or these groups aren't represented at these information sessions.
That is correct. They are not.
And how do you find out about their existence?
Because of the way the networks are put together, each plan will say, these are the groups in our network. We have a SHARP group, a Scripps group, an IPA group, or something like that. And then you go and say, well, is my doctor in any one of these plans? Here's his name, her name, and that's how you find out.
Okay, so the plan providers are responsible for providing you with the information about this.
That is correct. It's their responsibility to disseminate whether or not the physician you want to have, be it a primary care or specialty care, is in their network.
Where does this leave those independent physicians who aren't a member of this group? Does that mean they're out of the system?
Generally, an independent physician not affiliated with an organized medical group or an IPA does not participate in Medicare managed care plans. So they would not be involved in the open enrollment process.
So this is something you need to be aware of when you're selecting a physician, not just for open enrollment period.
That's correct. And again, this would apply to people who are going through this process for the first time.
Okay, very good. Are there any other changes to Medicare this year that we need to know about?
Well, Medicare is stronger and very robust this year. They have expanded their preventive medical screenings that plans offer. There are free cancer screenings, there are free flu shots, a lot of things that are focused on preventive care. Medicare is looking more and more to groups and organizations to manage the entire person from the time that they visit the primary care physician the first time to specialty care provider to perhaps if they're hospitalized to post-discharge to a skilled nursing or physical therapy or any of those natures. So Medicare has become more focused on keeping their beneficiaries, whether it's traditional Medicare or whether it's Medicare managed care, healthy over the long term. It's very robust, very healthy, and very focused on the individual.
You know, you've had a close involvement with this for a long time. Is there a frequently asked question list? I mean, I think the number one is clearly the Obamacare issue.
That's correct.
There's probably some after that. So if we could wrap up with, you know, some of the most common questions you get and or mixing in there the most common problems you see people encounter with this process.
Well, I'd say some of the more common questions are a few things we've touched on already. Is my doctor in this plan? Whether you're focused on primary care or whether you have very specific specialty care needs, that is one of the most common things. I like this insurance product because it has no copay or it has no premium, but they often come with very narrow networks. So you may find a plan that fits you great, but then you may find out that they don't have your physician in it. So probably the number one question that people would ask is my doctor in this network? The second thing is to find out how this will impact you on a monthly basis. Will you be paying a premium every month? What is the size of your copay? Are you going to be paying $30 per doctor visit, $20? And then again, for people who are mindful of prescription drugs and prescription drug expenses, what kind of drugs are covered in this plan? You know, I happen to be taking these 3 or 4 things. Are these covered by your Part D supplement? So those are the main questions that we get, and actually those are very important questions I would encourage everybody to ask.
You know, you mentioned the type of drug a couple of times, and I'm wondering, is there a significant difference between the plans in terms of the types of drugs that they cover?
To a certain degree, each plan has their own formulary, which is considered proprietary by them. And sometimes the newer classes of drugs or the newest type of treatment may not yet have reached the formulary. So if you're a cancer patient and you're taking a medication that only came out a month ago, it's FDA approved, but it's brand new to the market, it may or may not be on the formulary of the plan that you like. So it's important to find out, you know, I'm taking XYZ drug, do you cover that in your Part D benefit?
So if you're coming up on this, if you're late 50s, early 60s, apparently, or it seems that, you should be paying some attention to getting physicians who are in the same group, or you could find yourself boxed out, where you can get a primary care person but not your whatever specialist we're talking about.
That's correct. Almost any primary care physician in our area obviously is going to take traditional Medicare. And I'd say probably 80 to 85 of them, 80 to 85% of them are also in a managed care program or offer various managed care plans. But there are some out there that maybe someone's been seeing for several years. It's important to ask them, hey, I'm going to be turning 65 in a couple of years, and I'd like to go to a Medicare Advantage plan. Are you a member of any group that offers those plans?
You know, every time you've said this, you've used the singular. Is it fair to say that most physicians are in one group only?
Generally, employed models, well, by definition, employed models, you're only in one group. Generally with IPAs, they also require exclusivity. So it's pretty much your choice is going to be, the choices you have are going to be based on where your doctor's at. So you can't choose the same physician in two different IPAs, or as an employed physician at, you know, UCSD Medical Group and as a private practice.
Okay, we promised we'd end with the dates, and so could you let us know when those info sessions are going to be again, please?
Sure. At Tri-City Medical Center, which again is in Oceanside on the corner of Thunder and West Vista Way, it is October 31st from 8 in the morning till 11 in the morning. There is a second program in December 2nd that runs from 2 to 5 in the afternoon. And if you instead would prefer to go down to the Wellness Center, Tri-City Wellness Center, which is in Carlsbad on El Camino Real, we have two opportunities there. October 16th from 9 in the morning to 11, and November 9th from 10 to 12.
And once again, the open and close date for the open enrollment period?
The open enrollment period begins October 15th, and it concludes on December 7th.
As usual, Wayne, you're full of good information about this topic. Thanks for joining us.
Thank you very much for having me.
And thanks for watching this program. We hope you heard some useful information. Please remember those dates. Do your due diligence, and here's hoping you pick a great plan for yourself. Thanks for watching.